know for myself that when I got pregnant, the only thing I was thinking about was growing a healthy baby and all of the stuff I was going to need. No one goes into pregnancy thinking about all the things that could go wrong as a result of growing your own personal human being. That is, until you start reading magazine articles, seeing Facebook posts, and hearing women tell their tales and horror stories. For so many women, the new reality after pregnancy is no more running or jumping, needing to keep legs crossed with sneezing and coughing to prevent leakage, investing more money than before on pads, and in some cases trying to learn to live life with pain and discomfort. Many women are left with a lot of questions. Does this happen with every pregnancy? Does it end with the pregnancy? Or does it carry on forever? And why? Why does this happen to us women? First, to understand this better, let's talk pregnancy. During pregnancy, the size of the uterus expands from the size of a grapefruit to the size of a watermelon, approximately 2 inches by 4 inches to 10 inches by 14 inches. As this is occurring, our bodies and center of gravity change and adjust. Our bodies begin to move differently, load differently, and our muscles function differently. We talked in the What is My Pelvic Floor video about the importance of three-dimensional movements of the hips, pelvis, and spine, forward back, side to side, and rotationally. With pregnancy, our bodies do not move as well in 3 planes of motion because of the increase in belly size, increase in breast size, changes in center of gravity, core muscle weakness, and hip muscular tightness, as well as because of possible pain you might be experiencing from the pregnancy itself. All of these problems separately or together can result in a shutdown or a shut off of our core floor. So we know the core floor is weakening during the 9 months of pregnancy, but what about delivery? Can I save myself by scheduling a C-section? Some people used to believe the answer to that question was yes. The truth is, pregnancy alone can damage your core floor, even without the trauma of childbirth, because of all the reasons previously discussed as to why the weakening begins in the first place. The truth is that childbirth is traumatic to our bodies, and vaginal births can cause damage to the core floor. In the case of tearing or an episiotomy during a vaginal birth, the pelvic muscles need stitches and repair work, which can weaken them and influence how they function postpartum. An additional effect of childbirth is that sometimes babies can take quote-unquote souvenirs on their way out of the vaginal canal, meaning pelvic organs can be repositioned or slightly pulled out as the baby arrives. This type of trauma can lead to issues with prolapse and possible urinary or bowel incontinence. Many women ask me about birth positioning and want to know whether some positions for vaginal delivery are better than others. Most women labor better in positions where gravity can assist them. Gravity helps to relax the core floor, making tearing and trauma sometimes less likely. Ironically, the position most women exhibit the tightest core floor muscles is in your classic delivery pose of on your back, feet in the stirrups. This position does not allow gravity to help and can often cause the opposite of muscle relaxation, making delivery more difficult and risking more damage to the core floor. If you have concerns about what position your core floor might be the most relaxed in for delivery, then I encourage you to look into seeing your local women's health therapist. She can use something called biofeedback to help define your most relaxed birthing position. Ultimately, with pregnancy, the best way to try to save your core floor is to keep your body moving in 3 planes of motion the best you can during the 9 months. Keep the core floor as activated as possible, despite all of the other changes going on with your body. Even with all the potential for damage, the best change of all is becoming a mom.